Good afternoon, everyone. I want to thank Joel Johnson, Executive Vice President of Friend Health, and Marco Jacome, CEO of Healthcare Alternative Systems, as well as Public Health Commissioner Dr. Arwady. The COVID-19 crisis has been hard on all of us, and its challenges have taken many forms, including being challenges to our mental health and well-being. Many of our Chicagoans have been struggling with heightened levels of anxiety, depression, and trauma, sometimes, unfortunately, with tragic consequences. What we must not allow is fear to grip us and prevent us from being able to cope with this difficult time. Just as with the virus itself, it's our residents with pre-existing mental health conditions that are very vulnerable at this moment. We have not only lost our mobility, but in many ways our sense of security, whether from the stress of job security, the safety of loved ones, or the forced isolation that's come from social distancing and staying home. To help us combat these challenges and give our communities the support they need, we have created a new package of mental health supports encompassing 3 key areas. First, community-based treatment. Second, telemedicine. And third, self-care resources. In respect to community-based treatment, we will be focusing on support on individuals living with serious mental illness through an evidence-based approach that will provide a holistic response to this pressing need. As part of our effort, we will be investing an additional $1.2 million in 4 leading community mental health organizations, who, taken together, are distributed across our city and hold deep roots in the communities that they serve. Thanks to their partnership, we'll be able to expand access for persons living with mental illness like schizophrenia, bipolar disorder, or other co-occurring issues. This new package will also expand access to assertive community treatment services and community support team services with a focus on Chicago's South and West Sides, and provide services to those who may benefit from a higher level of support, as well as increase access to outpatient mental health services in communities most in need. To strengthen our telemedicine resources, CDPH, our Department of Public Health, is purchasing Doxy, DOXY.me, to deliver digital behavioral health services at its mental health centers in Bronzeville, Inglewood, Greater Lawn, Lawndale, and North River. For those of you that don't know, telehealth technology is a powerful, practical tool to enhance mental health services for individuals with limited access. This move will allow CDPH mental health centers to offer psychotherapy, case management services, and other resources to residents across Chicago, regardless of income, health insurance, or citizenship status. And I want to emphasize this again. Every single resident is eligible for these services regardless of income, regardless of health insurance, or citizenship status. If you need them, these services are there for you. And you can reach them by simply dialing 312-747-1020. That's 312-747-1020. And finally, through a partnership with 10% Happier, our city is supporting self-care through a newly launched website, Wendy City Wellness. This will include a curated collection of talks, guided mindfulness activities, and sleep supports from a diverse set of wellness experts. This site is designed for all Chicagoans to engage in their own well-being through relaxation, mindfulness, and meditation techniques. And I encourage everyone to visit the site at 10%.com/Chicago. I'll invite Dr. Arwady up here in a moment, but before I do, I want to add that While these measures may be COVID-focused, they are in fact the latest in a series of steps we've taken over the past 12 months to support mental health in our residents, bring mental health out of the shadows, and elevate it to where it needs to be. The issues we're addressing now didn't start with COVID, and they aren't going to end with it either. That's why we made our investments in mental health in this year's budget and announced our mental health framework for health equity earlier this year, and why we will continue to work with our city's advocates, experts, and patients and communities to enhance mental health care in Chicago and give our residents and families the support so many desperately need, particularly in this time. And let me just say on a personal note, to state the obvious, this is an incredibly difficult time. I feel the weight of this moment every day. And as a result, as part of my wellness routine, I have leaned into my faith even more. I make sure every day I have time just to be alone, to breathe and put the burdens of the day aside. I'm intentional about finding hope and love in the selfless acts of others. And I allow myself to cry and feel despair. That is also part of this moment. I don't compartmentalize my grief, despair, or fear, but I work very hard in acknowledging those very real and raw feelings, but also not to let them overwhelm me, and to be intentional every day to find ways to let myself heal and recover. I wanted to share these things because normally when people ask me how I'm doing, my stock answer is fine under the circumstances. But the reality is, it has a lot of layers and nuance. With that, I'll now welcome Dr. Arwady to the podium to provide further details. Doctor.
Thank you, Mayor Lightfoot. And thank you very much to both of you for your partnership from your organizations. Really looking forward to working together more. So let's start by noting that, of course, we've crossed 100,000 COVID-19 cases here in Chicago. 38,783 of those cases have been in Chicago residents. But I did want to highlight that many of the people who have gotten COVID-19 in Chicago have already recovered. We estimate, in fact, that 26,983 Chicagoans, approximately 70% of the people with COVID, are through the disease, are no longer infectious, are back, if they're essential workers, at work or otherwise back at their life activities. We have approximately 10,000, we're estimating 10,012 people who are still in the recovery phase. They're still potentially infectious, they're getting over COVID. And we have, unfortunately, 1,788 Chicagoans who have died from COVID-19. That represents between 4 and 5% of the people who have gotten COVID-19 here in Chicago, which helps us know that there probably have been many more people who have had COVID-19 but just never got tested. Regardless, though, all of these people, even the 70% of folks who have physically recovered, undoubtedly are still having some degree of mental health effects from the results of COVID. And it's not just the 38,000 people who have had COVID. I would venture to say just about everybody in Chicago has had at least some low-level mental health awareness effects from what's been happening with COVID-19. You know, I don't go a day without seeing a question coming on Facebook or have a conversation with someone where we're talking about isolation and loneliness. We're talking about depression and anxiety and feeling on edge, having difficulty sleeping, having trouble staying asleep, differences in the way that we're eating, differences in the way that we're interacting even with loved ones. And even as we think about Chicago and Chicagoans recovering physically, right along with the physical impact that this has had, absolutely, there is going to be mental health work that we need to do as a city. And in the same way, with all of the job losses, we've noted so many more people needing to access food help, for example. My hope is that the stigma that people may still feel, the embarrassment about needing to have some of the most basic needs met of food, where we've been having a lot more pop-up food pantries, we've really been encouraging to say it is not a shameful thing if you right now are needing food assistance. My hope is that we can use this opportunity of COVID-19 to think about mental health in the same way. This is not embarrassing. This is not something we should not talk about. This is not something that should have stigma around it. This is something that, in fact, all of us, to a degree, are at risk for, and the data really bears this out. The Northwestern Coronavirus Data Survey says that right here in Chicago, 44% of us are saying, agreeing with the statement, I feel very isolated. Isolation is a known risk factor for problems with mental health. The NORC study out of the University of Chicago, they're doing an ongoing COVID survey, found that just in the last week, 66% of women and 54% of men report that at least on one day in the week, they were having symptoms of depression, anxiety, loneliness, or helplessness. But also, people are reaching out more when they are having mental health issues, and that is what we want folks to do. So, for example, the SAMHSA hotline, which is a national hotline that takes calls in from people who have concerns about mental health or substance use, also can get texts. And just last month, in April, they had more than 20,000 people texting, looking for mental health supports, compared to less than 2,000 the prior April, 10 times increase. Here locally, our NAMI hotline, which is one of our major hotlines for getting mental health help here in Chicago, calls in Q1 were up 63% compared to where they were in Q1 last year. And so my overall message is that although we're making some new announcements today, this is just part of what the City of Chicago is doing, what the Chicago Department of Public Health is doing, and what we need everyone in Chicago to be doing, talking about mental health in the same way that we talk about physical health, as something for which you can get support, for which you can get treatment, and that is as much a part of recovery as the physical recovery numbers from COVID. So the announcement that we're making today, as the mayor says, is really a build on the framework for mental health equity that we announced, and a roadmap to really thinking about how to improve mental health access for those most in need. It's especially important because of the COVID-19 pandemic, but that has only exacerbated the psychological and emotional well-being problems that we've already seen in Chicago residents. We know that the loss of life, but also the economic insecurity, the social isolation, the disruption of ordinary daily routines, and right now, the uncertainty about the future. Those all represent population-level factors. Those can create or they can make worse experiences of despair, hopelessness, stress, anxiety, and trauma. But we can do something about this. We know that even before COVID, behavioral health hospitalizations, meaning the people who are having the most severe problems with mental health, are concentrated in Black Chicago and in populations in Chicago with high economic hardship. For example, prior to COVID, if we look at the community areas that have low economic hardship, meaning generally high incomes, there are about 6,000 people or 6,000 hospitalizations that come every year with people who live in those neighborhoods or those zip codes. In contrast, we have 27,000 hospitalizations every year for behavioral health in the community areas that are high economic hardship, meaning generally lower socioeconomic socioeconomic status. And so, as always, as we are driving our investments as a city and as a health department, we certainly are thinking about everybody, but we are concentrating investments where they are most needed. And so, as the mayor said, the first major announcement is this expansion of community-based treatment for persons living with serious mental illness. In partnership with these organizations and 2 others, this is to bring mental health treatment out of the clinic, recognizing that there are people who are just never realistically going to be able to keep a 10 a.m. appointment on a Monday, people who are living with schizophrenia or bipolar disorder or co-occurring disorders who need some more intensive care and outreach in the community to make sure that they can live independently and experience recovery. So these treatment approaches, like the assertive community treatment and the community support teams, offer 24/7 work to bring the needed mental health supports to folks who most need it. As you know, with COVID-19, we've been doing a lot, in particular, to protect people who are unstably housed or homeless here in Chicago. So, for example, we put a shielding program in place for people who were older and had underlying health conditions, didn't wait for them to get COVID. We've been housing them in some of the quarantine hotels and in other individual settings. A lot of those people also have co-occurring mental health conditions. And as we are thinking now about how to move those folks into permanent supportive housing, it is opportunities for treatment like the ACT and the CST teams that can make sure for the hundreds of people who not only have the physical conditions that make them at risk for COVID, but have the mental health concerns that make it harder to live independently. It is teams like this that will help those folks continue to be successful. Secondly, this expansion of telemedicine is a big deal. The expansion in our own clinics means that not only, as the mayor said, can anybody get treatment, you can get treatment from wherever you now live in Chicago, because we can do it via telemedicine. And it is free, I want to emphasize. It's the first time we've had this telemedicine platform, and it really lets us have low barrier access to mental health services. We offer psychotherapy, psychiatry, psychosocial groups, case management services, again, regardless of income or health insurance status. Here, too, we've already seen our number of encounters in the mental health clinics go up. In the month of April, 23% compared to what we've seen in the January to March. Partly because as people are learning about these new technologies, it is dropping some of the barriers like transportation or other reasons that sometimes makes it hard for people to keep appointments. So please, if you need mental health care, the CDPH mental health clinics are one opportunity and way to reach it. And then finally, where we think about everyone, if you are not currently linked to some kind of mental health support, I would ask you to check out this new website that is in place in partnership with 10% Happier. Really want to thank them for this. 10%.com/Chicago, the Windy City Wellness page. This, again, entirely free, available to all. If you've never tried meditation, here's a way to try it out from your own cell phone or in the privacy of your own home. If you want to hear about talks or you want help with sleeping, here's a really easy way for everyone to check it out, and I encourage you to do so. So these are just the beginnings of the work that we have planned for mental health here in Chicago. We want to think about supporting individuals with treatment, especially the people in the neighborhoods who most need it and have serious mental illness. But we also want to think about ways to build connection. So you'll be hearing more in the weeks to come as together we think about getting through COVID, not just physically, but recovering in a way that actually makes us stronger from a mental health perspective. The goal of our framework for mental health equity is absolutely in line with the goals of getting through COVID-19. We're going to bring mental health services to everybody, but we're especially going to work to bring them to the people and places where they're most needed. If there is anyone right now who is not sure where to go for mental health resources, I would refer you, first of all, as always, chicago.gov/coronavirus. There's a whole section on there about mental health resources. But the National Alliance for Mental Illness here in Chicago is 833-626-4244. Also, if you call 311, they'll connect you to them. They're open Monday through Friday, 9 to 8, Saturday and Sunday, 9 to 5, and always 24/7. You can text the word HOME, HOME, to 741-741. That's HOME, 741-741. Someone will engage with you and help you get treatment. Thank you. Please pay attention to your mental health. Be kind to yourself, especially at this time. And I look forward to having more opportunities to talk about this with you in the future. And with that, I'll invite up Joel Johnson. He's the Executive Vice President of Behavioral Health at Friend Health and a major proponent for mental health here in Chicago. Thanks.
Thank you, Mayor. Thank you, Dr. Arwady. Again, my name is Joel Johnson. I'm the Executive Vice President of Friend Health, a federally qualified health center. I also have the distinction of being the president of HRDI, which is our subsidiary community mental health center. The combined mission of Friend Health and HRDI is to provide a high-quality, patient-centered, integrated system of care for all, which includes accessible mental health services for residents on Chicago's South Side. I'm thrilled that Mayor Lightfoot and her team recognize that a critical need in our city is to build more capacity for community-based treatment teams on the South and West Side. This is consistent with the race equity agenda that the mayor and CDPH have been speaking about both prior to but during COVID-19's pandemic. By getting residents connected to services that address the underlying needs as well as the anxiety and stress of these times, we're able to prevent residents from cycling through deeper end systems, engaging with first responders, and ending up in our emergency rooms and jail. And instead getting the help that they need to reach recovery. We're excited to be a part of this innovative partnership and look forward to working with the mayor and her team as we build more services in the parts of the city that need it most. Thank you again.
Thank you.
Thank you.
Yeah, and then I'm inviting up Marco Giacome, Chief Executive Director of Healthcare Alternative Systems.
Good afternoon. My name is Marco Giacome. I'm the CEO of Healthcare Alternative Systems, a behavioral health organization. First of all, I want to thank the mayor for this wonderful opportunity and invitation to be part of this amazing program. Even prior to COVID-19, the commitment of Mayor Lightfoot in terms of increasing mental health was there. And so I appreciate it for being sensitive, especially in this need. I also want to thank the Commissioner for commitment in terms of expanding services for mental health services, primarily for the minority population. My organization works mostly with the Hispanic population in the west side of Chicago and in the north side of Chicago. So we thrill in terms of being involved in this opportunity because right now our communities don't suffer. There's always being a lack of services in mental health and substance abuse, and now there's opportunity to expand those services. Equity and parity, especially in the minority communities that the Mayor Lightfoot have committed, is a greatly appreciated. I think that is needed, and in our community we will thrill to have the services that we provided. I also want to say some words in Spanish, if it's okay. Yeah. En estos momentos hay una necesidad muy grande en la comunidad de no solamente servicios humanos o de salud mental, pero otra clase de servicios como casas, trabajos, comida. Los hispanos que viven en el sur oeste de Chicago están sufriendo altos niveles de coronavirus, causando un impacto grande en la salud mental de la comunidad. Queremos agradecer el liderazgo de la alcaldesa Lightfoot por su compromiso de ayudar a nuestra comunidad. La alcaldesa entiende la importancia de proveer servicios que son a menos en términos de envueltos, enfocados en culturalmente, lo más importante. Como sabemos, nuestras comunidades siempre tienen un poco de hesitación o de miedo de atender a servicios donde no conocen a la comunidad y no están acercados o proveyendo servicios culturalmente. So queremos agradecer again a la comisionada y a Mayor por todos los servicios y la oportunidad que nos da para nosotros seguir sirviendo a nuestra comunidad. Gracias.
I'm happy to take your questions.
Thank you, Mayor.
Good afternoon.
Good afternoon. There might be some listening who say mental health includes exercise.
Yes.
They'd love to get back to the lakefront. They'd love to get to the 606 trail.
Yes.
They'd like to get back out there. So is it time to give your vision of when they might be able to do that?
Well, the when question, and it really is a when question about a lot of things. We're getting a lot of questions about, hey, is May 29th the magic date? The magic date, to the extent it exists, is when we hit our metrics that we set out on public health. It's when we see that we've made significant progress on ICU beds, hospitalizations, number of COVID patients in ICU. It's when we see the level of testing get to where we want it consistently every day. It's when we see the positivity rate of people testing positive for COVID fall below a certain threshold. So we've been very, very clear and consistent, and we will continue to be about what those metrics are. Now, with respect to the lakefront, I think I've been consistent all along to say we're not there yet. We are actively looking at and working on plans so that when we do hit these metrics, that we have a robust plan in place to allow people to enjoy the lakefront, the 606 trail, the Riverwalk, the other areas that we closed, but do it in a way that's safe. And in thinking about what that means, I am mindful of the fact that in the days leading up to the closure of these outdoor treasures, we did everything that we could to try to bring people into compliance, talking on a daily basis for weeks beforehand, trying to educate people into compliance, talking about why it's not safe to congregate, and then having me stand at a podium like this and rattling the saber and saying, this is a problem, we have to change this. And all of that, unfortunately, fell on deaf ears. I will say that there's not a day that goes by that I don't get a call, a text, an email, or all the above asking about the lakefront. I understand that. The lakefront is the treasure. But we have to do this at a time when we're safe and in a way that we can remain safe. I'm very worried about, and we've seen it in other places of the country, I'm very worried about a spike and a surge in cases when we do open back up. And so we're going to work to try to mitigate against that, but having thousands of people congregating on the lakefront is one of the surest ways that I know that we would have the kind of surge that would set us back and then have us have to reimpose additional restrictions on mobility. I don't want either of those things to happen.
Do you envision the lakefront 606, Lincoln Park Zoo, all Riverwalk all together at one, or might separately be open?
They may separately be open. I mean, we're working with relevant stakeholders around those things. But look, the reality is when we closed down the lakefront, somebody said, and it was right, well, what about the adjacent parks? So they all kind of go together. So I don't see a reason for us, unless we think there's a significant localized specific problem, not to try to go with all of them at once. Now, subject to change. And as I said, we are actively at work and having conversations. And in fact, I have a meeting in about an hour specifically around the lakefront. I'm anxious to get it back open as well, but we have to do it in a way that's smart, because it's not just the lakefront. It's, well, what do we do about the marinas and boating? What do we do about golf? And we've got golf courses, as you know, along the lakefront on the north side and the south side. So there's a lot of pieces that go into shutting down and then reopening, and we're looking at all of them.
So you said May 29th is not a magic date. What does that say to those who thought they were going to be dining at an outdoor restaurant, perhaps?
I don't know why that would be so, why they would have that expectation. May 29th is the expiration date of the state stay-at-home order. As everyone surely knows, the city of Chicago has its own responsibilities and obligations to craft policies, public health policies that are specific to the city of Chicago. And we are hard at work on looking at ways in which we can get our restaurant industry back up. I was heartened by the comments that the governor made yesterday about restaurants. But again, like everything, we've got to do it safely. I need to understand and be certain that restaurants across the city, not just the big ones, not just the ones that have a lot of cash flow, but the small ones too, have a means to protect their employees and members of the public that will patronize them. That's why we've been talking openly about, well, what do we think about creating some closed streets, open spaces for restaurants to be able to open up and use the open spaces. But the reality is the other piece of it, and this is a conversation we have to have with the state, no restaurant I know of is going to be able to survive dependent upon what the weather's going to be like on a particular day in Chicago. I think having the opportunity to do it and dine al fresco on a larger scale, which is what we certainly are talking about, is important. But they also need the ability to be able to be inside as well, or economically, I don't think the numbers work. But again, that's a conversation we need to have with the state.
So closing streets, does that happen with city council approval, or may you just have an order that says, okay, we're going to open up Wells Street or whatever street it might be?
Well, we're absolutely doing it. We will do it in consultation with the local alderman, but I don't believe that it requires formal council action. But we are talking to aldermen, particularly in areas, I'll take Brendan Riley, like downtown, Brian Hopkins, downtown. We're looking at Andersonville, Logan Square, Wicker Park, other parts of the city. And now, of course, because I haven't named every part, some aldermen will say, wait, what about me? But we're looking at, and what I've asked my team and asked the Illinois Restaurant Association is to tell us areas across the city that we think that we can get some synergies by looking at open spaces, and that's what the work is right now, in addition to what are the really concrete, granular guidelines that need to be in place to protect employees and protect patrons.
So are you saying no to May 29th or maybe to May 29th? I
don't think we're going to be ready by May 29th, but my hope is that soon in June that we will be ready.
And again, what it is a conversation that is there a checklist and all of that you need from the restaurants as well as the health department?
We are actively, and have been for weeks, actively involved. We have some draft guidelines that are still being massaged. So I think we'll be close to knowing what the framework looks like, but it's really the when question is going to be dependent upon the public health data.
And even if there is pushback, because you could go to perhaps close by Evanston or go to Naperville or go to wherever, but not downtown, you're okay with that?
I'm the mayor of Chicago, and what I got to do is look out for residents here. I can't account for what happens in Indiana. I've heard a lot of conversation about that, or Wisconsin or Iowa or Evanston, because they're public health metrics are different than ours. They are experiencing COVID-19 different than we are. So same with our folks in DuPage County. All I can do is account for what's happening on the ground here in Chicago. I think we've had very, very good, robust discussions with industry leaders, and we're talking about restaurants, but it's really across the board. And I want to make sure that we understand what protections they're going to put in place, what commitments they're going to make to protecting members of the public and their employees. And we're close, but we're not there yet.
All right, to Dr. Arwady from Univision, similar question on restaurants. Now that they might be opening, could you give advice for what level of exposure risk will appropriately be safety as a patron should you be taking? What kind of safety measures should you be taking or expect from the waiters and the people at the business?
Yeah, so this is exactly the conversation that's happening right now with a lot of partners. We're thinking about what needs to happen structurally in restaurants and other food establishments, everything from, face coverings to occupancies to not using the same ketchup bottle. There's a lot of details that come into play where you think about creating the space and the protections that need to be in place. We will not be able to completely eliminate the risk of COVID-19 as long as we have COVID-19 here in Chicago. But our goal is to minimize that and to make sure that as we move toward this new normal, we do it carefully in ways that continue to keep the outbreak in control at a population level. So there will absolutely be specific things that restaurants will be required to do. And the biggest thing that's going to make the difference for everybody moving forward is that we continue to have awareness about the need to maintain that 6-foot physical distancing as much as we're able to, that we continue to wear the cloth face coverings, especially if there's a setting where we may not be able to maintain that 6 feet distance, and that where there are not needs to have close interactions with people, especially right now this summer where we're just getting over our peak, that we limit those opportunities. So we'll be sharing much more about all of that. It's going to be the big conversation of the summer.
Well, there might be one other one, if you don't mind staying for just a minute, and that is about swimming. Where do you stand on public pools or even private pools?
So this morning, actually, on Facebook, this comes up quite a lot. We get questions about water. So, COVID-19 is not in the water itself. So it's not that it gets spread through the pool or through the lake. The concern, of course, is the interaction of the swimmers. And so where I think about a pool in somebody's backyard that they're using sort of with their family, I don't have a concern for that. The public pools are part of the larger conversation that we're looking about. Where are we as a city? What structural things need to be in place? Those would be a much bigger decision because it is difficult to keep that sort of physical distancing. I think especially where you think about kids playing in the pool, but it's part of the conversation.
Thank you. Mayor, from Heather Sharon, she is wondering, with Latinx and Black Chicagoans making up 76% of the deaths from the coronavirus, does it make sense for Chicago to move to the next phase of reopening, including these limited restaurants, which would require more Latinx and Black Chicagoans to go back to work or face losing unemployment benefits?
Look, that's a very fair question, and it's certainly one that we have talked about. I don't think we can discriminate against certain areas, and God forbid, we certainly don't want to stigmatize people. But I do have concerns about putting folks at risk. And all of this is no easy decisions. A lot of it is balancing a number of complicated issues at the same time. But I can say that this is a topic of conversation that we have had and that we continue to have when we start to think about opening up. But first and foremost, in both the Black Chicago and Latinx communities, we've got to continue to educate people and connecting them up with services. I think that is the most important thing that we can do to bring people out of the shadows, to understand what the unique circumstances are on a community by community basis, and then make sure that we are there as a government with testing, which we've done, with connecting people up to healthcare providers, and linking that testing between the two, which we have been very, very dogged about making sure that we do that. But we still have to do a lot more to really stem the spread of COVID in both these communities. And every day, I start out my day with a call, and one of the first things I hear is where we are with the percentages of increase or decrease in various demographics, including the Black and Latinx communities. And it is a particular area of focus for us. It's a particular area of concern. And we're going to keep driving on the various interventions that we have developed in partnership with people in those communities. But Heather, it's a very fair question.
Craig Dellamore wonders, what are the guidelines that will have to be in place for barbershops and hair salons to open up, and will they be in this next phase? They are in the state's next phase. Are they in the cities?
Yeah, I think they will be in the next phase, but like with Look, let's just say this. The baseline for all businesses to open back up are two things. What are you doing to protect your employees, and what are you doing to protect members of the public? You know, we have benefited from the experience of other countries that are ahead of us in the arc of their virus and other parts of the country. You know, for example, on the restaurant issue, my friend Jane Castor is the mayor of Tampa, Florida. They have a very interesting programs they put together around restaurants. So we've looked at that, talked to her people about that. We're looking at LA and San Francisco and Seattle, and we're looking at Europe, a number of countries there that are weeks ahead of us, both in terms of their experience with the virus and their process of opening up. But the two fundamental questions that I ask and I press my team on, and I'm pressing the industry groups, are what protections are going to be necessary for employees and what protections are going to be necessary for members of the public. And we're asking the same questions of ourselves as a government. Look, we're going to open back up City Hall at some point relatively soon. And we're asking those same questions. What do we do to protect our employees? And what do we do to make sure we're safeguarding members of the public? And how do we make sure that people don't have to congregate downtown at City Hall to get access to community services? So all of that is part of the discussions we're having.
And Fran Spielman wants to know, how will the CTA service change when people start returning to work? How will they reassure customers that it's safe? And what needs to change about the way the CTA operates?
Well, I think a number of things, and that's part of the reason why we're engaged in conversations with our regional partners, because the CTA obviously reaches a number of different localities outside of the city of Chicago. Same conversation that we're having with folks at Metro, and the same issues. How do we clean? How do we make sure that we've got spacing and social distancing so we don't have kind of the traditional rush hour with people congregated on platforms and at bus stops? How many people will we allow on a bus at any given time? Now we've got limitations. On the regular buses, I believe it's 12 or 15. On the larger buses, it's in the low 20s. Are we going to change those numbers in any way? I'm not sure that we will. Does that mean that we've got to put more buses in service, particularly on some of these heavily trafficked and traveled bus routes? Same thing with the trains. So I don't have an answer for you today, but what I can assure you is both Thorvald Carter, the president of the CTA, his leadership team, in consultation with me in the mayor's office, we are having those conversations so that we can say to the public in a very specific way, here's the things that we're doing to make sure that we've enhanced the methods and methodologies to keep you safe, and the employees too.
Mayor, churches continue to be a question asked by to us a lot, especially when they hear that restaurants might be opening or stores might be opening retail and they can't still go to church. Could you talk about that? Was it an overreach to take the cars that were parked near the churches away on Sunday? And also, could you react to Reverend Willie Wilson paying the fine that some have received for holding services?
Yeah, I mean, look, this is a question about how do we come together in our various faith traditions during this very difficult time. And I want to say a couple things about that. Number one, there's lots of ways in which you can express your fealty to your faith without coming together in a way that puts yourself and other people at risk. And we've had very, very good, candid, raw conversations with members of the faith community. There's a big convening that we're hosting today for a working group to work through some of the same kinds of issues that we talked about with restaurants and otherwise. You know, when you think about the ritual of service, it's not the same as going into a restaurant. It's not the same as going into a retail center. And as Reverend Meeks told me the other day, you know, when we come together, we come together. We want to celebrate our kinship with people who are expressing their faith in the same way. But how do we do that safely? How do members of the choir come together and sing and express themselves through song in a way that's protected? You know, I don't know about you, but when I sing, I'm expressive. And droplets are coming out of my mouth. I may be sweating. Those are the very circumstances where the virus can breed and spread because there's risk. When we talk about passing the collection plate, well, how do we do that in a way that is safe? When we talk about taking communion, right? There are many faith traditions where people drink from the same chalice. Well, how do we do that without putting ourselves at risk? So we are in communion with the members of the faith traditions, asking exactly those questions so that we can craft guidance that will allow people to come back safely, in groups of 10, and then be able to perform things like weddings and funerals and baptisms and bar mitzvahs, and have service again, but do it in a way that doesn't put people with underlying medical conditions, which the faith community is populated with those folks, or our seniors, are people who are both are seniors and have those underlying medical conditions. No one wants to do a call to service, if you will, and put people at risk.
There might be some mayor who are going to say, what about at your own risk? That you can't necessarily, control everyone's, especially when they hear and I know you've said many times you're only the mayor of Chicago, but if you can go to church in another area, it cause folks to say, wow, I can go to church in Indiana, or I can go to church in Minnesota.
Yeah, but you know what? Here's what I would say about that. We have made a difference in saving lives in the city because people have understood the need to adhere to the guidance. And that can't be said in other parts of the country, and other parts of the country right around us. Again, I don't like to cast aspersions on other states and other cities, but you look at what's happened in Iowa, you look at what's happened in Georgia or Florida, and some of these other states that just have not paid attention whatsoever to the guidance of reasonable, smart public health experts. We're not them, and we are not going to be them. We're Chicagoans, and we're going to be smart, and we're going to be safe, because that is what's necessary truly to save lives. When I find myself in the circumstance of calling the survivors of people who have died, I don't want their deaths to be in vain, because we are so fixated on a moment of pleasure that can impact our city for a lifetime. And yeah, I will say the same thing that I tell my 12-year-old. I don't care what other people do. You're my kid. I am the mayor of the city. I have a responsibility and obligation to speak the truth, even when people don't want to hear it, even when it's hard, because that's what's the right thing to do. And I'm going to continue to do that. I want people to be able to enjoy their life. It's going to be 80 degrees this weekend. And I feel the burden of having to say to people, stay inside for your own safety. But that is the right thing to do. And I'm going to keep being guided by the science, by the public health experts, and I'm going to keep hammering the message that I think is important for people to hear, not only just hear, but adhere to. And I'm going to use every lever in my power to make that happen.
Fran Spielman is asking about your chief financial officer predicting a $500 million budget hole. How do you plan to fill it?
Well, I'm not sure that that's exactly what she said. However, it's substantial for 2020 is what she's talking about. And then obviously we have other issues that we have to attend to for 2021. And we are looking at an array of options to address the impact. And projections of a number that big, and those were simply projections, are based upon what we see in the first couple months of the impact on our revenues. March obviously was a tough month. We were okay at the very beginning, but the cliff fell off. by the middle of March. April's been really, really tough, and we're still starting to get those numbers in. And May's going to be equally challenging. So we are doing what we really did last year, which is to start internally first, looking at ways in which we can find savings and efficiencies first in the way in which we operate, the way in which we deliver services. I've said this and I will say it again. The last thing I want to do is raise property taxes, but I can't take that off the table. But it's at the very end of that table. The last thing, one of the other things I really am loath to do is to lay people off. Laying people off in this economy, that's a hard thing to do. With the challenges that people are facing, that's got to be a last resort, along with property taxes. However, we've got a steep mountain to climb because of the loss of revenue. And our team is hard at work on looking at a range of solutions. And when we have honed those down, we'll be talking about them very transparently and very publicly.
Charlie Meyerson at ChicagoPublicSquare.com is asking, what's the city's guidance to Chicagoans on the new iPhone and Android system upgrades to notify people automatically if they may have been exposed to the coronavirus?
So I'm going to ask Dr. Arwady to speak to that. We've been following those developments, the development of that software, and really an historic collaboration between these two tech powers very closely. I don't know that that technology is ready yet. Based on the last that I heard about it, I think it's interesting. Obviously, there's a lot of privacy concerns that go along with that, but I think it's a very interesting thing. And really what you're talking about is contact tracing, but using technology as a means to address that. Technology's got to be part of the answer. But we're watching it with interest, but also with caution. Doctor?
That's right. I'll just add that I want to be clear that when people are registering for the Chai COVID Coach, which of course is the city's app that allows people to put in information, track their symptoms, that in no way at this point is at all linked to any of this location finding work. That is a way to directly communicate with the Chicago Department of Public Health. It allows us to connect people to testing, allows them to pre-register for vaccine. We may build in some contact tracing, but it would be with the agreement of the people who are part of that app. So I just want to be clear that this conversation that is happening at a much sort of broader level is not directly linked to the contact tracing that the city of Chicago is using. We certainly have been part of some of these conversations. It's a larger national conversation. There are apps that need to be downloaded that are also part of this. So it's not just the automatic piece, but it's not a priority piece here. We're working on getting the basics in place first, and you'll be hearing more about our contact tracing plans in the days and weeks to come.
Thank you. I only have one last, it's non-related to phase 3. Do you want me to go ahead and ask that, or do you want to finish up the phase 3?
No, go ahead.
The last one from Will Jones, ABC 7, about this weekend and Memorial Day. Mm-hmm. What plans are in place to make sure violent crime doesn't rise over the holiday weekend?
Well, the superintendent is going to be hosting a press conference tomorrow to talk about exactly those things. But we have been working a lot, both from a law enforcement standpoint, but also with our community partners to look at ways in which we can think creatively about activities to engage our young people in particular, to keep people safe. But I won't steal the thunder of the superintendent, because he's going to be expounding on that at length tomorrow.
Thank you for taking the questions.
Of course.
On topic question from Univision.
Sure.
Which of these mental health services are available in Spanish?
I'll let Dr. Arwady answer that.
So all of them are available in Spanish. The partnership with the 4 community agencies in particular, these are designed to be teams that can go out and interact with people who are at highest need. Certainly one of the things that we look for is the ability to make sure that people who are Spanish speaking can have that met. Our own services at CDPH are offered in Spanish for free through the clinic. And then finally, there are Spanish resources available on the website.
Dr. Arwady, another question for you. From Kelly Bauer at Block Club. How can people safely meet in groups of 10 or fewer during phase 3? Should people only see the same 9 people? Should we still wear masks and stay 6 feet apart? Can we hug and touch?
Okay, so this again gets back to the fact that as we sort of move ahead, we're not going to flip a light switch here, and it's going to be sort of an expansion of the bubble, if you will. And people will have differing thoughts about how to do that. I think the reason why we move to a 10-person gathering is that there is then some external limit on what those meetings look like. But there certainly are people who are thinking carefully about the ways in which they will expand their bubble, if you will, from beyond the people who live in their immediate household. And some of that, frankly, I think will depend on the individual. If I am a person with underlying health conditions, if I am a person, who is older or both of those, I would probably recommend not expanding that bubble really at all unless there is a substantial need. And this is where you're balancing the mental health needs, the essential health needs. It's sort of a balancing act. Broadly, the safest thing to do is to not have interactions with people closely. Like every time you have interactions with people, especially within 6 feet, especially without a face covering, you have the potential for spreading virus. But recognizing that we all are moving ahead and that is appropriate. And the reason we need to be on the downward trend here in Chicago is that the whole point is that as you open things up, you do see some more infections with that by definition. But as long as those new infections are coming at the time when the city as a whole is coming down, it doesn't overwhelm it and you're able to keep moving forward as a city. And so I would just encourage people to be thoughtful about who they are sort of letting into their bubble. And that can continue to expand as the summer goes on. So, it may be something where you're thinking about extended family, or it may be something about where you're thinking about some close friends who maybe together you're going to say, all right, these are the people who maybe I'm going to interact with most closely. We cannot eliminate risk. I want to be clear about that. And so the goal is to use your own personal circumstances to be as responsible as possible, to not be getting in huge gatherings and to not be unnecessarily giving opportunities to spread infection. So as long as people are being aware of that, I think, keeping that 6-foot distance, wearing the cloth face covering whenever they're not intentionally gathering, and then when they are intentionally gathering, being conscious that especially if there are people who have underlying conditions or who are older, they need to be especially then careful about other activities that could introduce risk.
Thank you. Mayor, question from Shia.
If I may, just
Yes.
follow up on that. But look, we're going to be talking more tomorrow about phase 3, so we can give guidance to folks. But I want to pick up on a couple of things that Dr. Arwady said just now, but also earlier. There's no vaccine. There's no cure. We're still at risk. COVID's still here. It's still getting people sick, and people are still dying. And so no matter what phase we move into until we get a vaccine, the basic precautions that we have all now know well that we've been living with are still going to be in play. You're still going to need to practice social distancing. That's just a given. Whether we open up a restaurant, a barber shop, whatever it is, you're still going to need to practice social distancing. These face coverings that are now ubiquitous everywhere, they are going to be necessary every time you step out of your house, period, for the foreseeable future. That is just going to be the new reality. You're still going to have to practice hand hygiene. And for people who have underlying medical conditions, I hate to give this reminder, but I will. What is it, doctor? 93% of the people who have died of COVID-19 in our city have died and had underlying medical conditions. This is a killer. It is real. And so we are moving forward. We are absolutely making progress. We are going to open up our city again and enjoy the wonders of Chicago in the summertime. But doing so still carries risk. And so, no hugging, no handshakes. We have to be careful.
Last two questions, Mayor. Question from Shia at Politico. Mayor, can you tell us where Chicago's and the governor's reopening plans disagree or digress?
Well, I don't think they disagree or digress. We've been, both of us, the state and the city, had been working on reopening frameworks for weeks before either of us announced. And it was appropriate for the state to go first, and they did. And then we looked at what our draft plan was to make sure that it harmonized and complemented the states. So the state framework is just that. It's a framework for the entirety of the state, from the southern part to the northern part and everything else in between. Ours is specific to Chicago. So though there are some differences, there's a speed at which I think we want to proceed that maybe wasn't initially contemplated by the state. But we'll work out whatever those differences are, because at bottom, the governor and his team have Chicago in their sights always. You know, we're the largest city. We're the economic engine for the entire state. And as Chicago goes, the state goes, and vice versa. So we work hard every day, the governor and I and our teams, to make sure that we are moving together in a way that advances the public health for everyone in Illinois.
And last question from John Byrne at the Tribune. On opening streets for dining, how much does the meter lease impact the ability to do that? Do you need to take parking spots? Do you need to pay for parking spots taken out of rotation?
It really depends on where we're talking about, and that's certainly an issue that we are working through as we think about where precisely the spots will be.
Thank you, Mayor. Thank you, everyone.
Thank you. Thank you.